Hello, everybody, and welcome to KSB Community Wellness. This is Luke Herbert, Director of Pharmacy at KSB Hospital, and with me today is Gabe Billiet. Welcome, Gabe.
Hi there. Glad to be here.
Happy to have you here. And today we are going to just kind of have a brief high-level review, I guess, of COVID-19 vaccines and kind of some of the updates, some of the things that are new, and in particular, we'll get into third doses and booster doses a bit, since a lot of that is happening right now.
Okay. I just want to preface, as with anything COVID related, this information is current as of our recording of today, which is November 17th. Let's start first off, Luke, and let's talk about vaccine safety.
Yeah, and so just to kind of circle back a little bit to, I guess, about a year ago, it's been about a year since FDA had gathered enough data for emergency use authorization for the Pfizer and then the Moderna vaccine. So, when they did those studies, we were looking at 15 to 20,000 people who had received both doses of the series of the RNA vaccines, and we followed safety and efficacy data for 2 months after second dose, and then in the meanwhile, then starting in December and into next year, we vaccinated a couple few 100 million doses of Moderna and Pfizer vaccine, and now quite a bit of Johnson & Johnson vaccine. So the surveillance for safety in the interim has been unprecedented, really. I mean, patients have had a daily email where they could reply back their side effects and unusual side effects as well as common side effects. And providers have had a heightened level of awareness where we provide reports of adverse effects, expected and unexpected.
Mm-hmm.
And then, go ahead.
What I found rather kind of nice about this vaccine rollout is, like you said, that feedback from our patients, from our prescribers, the app that patients could download to report side effects and report problems, and just that follow-up. That's been a very nice use of technology to help kind of ensure safety, ongoing with it, in my opinion.
Yeah, absolutely. And the FDA also did some ongoing surveillance where they worked with some health systems and medical centers and tracked tens of thousands of vaccine recipients for longer than 2 months after the second dose, and very closely did surveillance for any particular side effects or any trends that they could see. So really, I guess what I'm trying to say is the surveillance has been above and beyond normal FDA approval. And then earlier this summer, Pfizer did apply for and receive normal FDA approval, indicating that at the minimum we followed the normal approval process for the Pfizer vaccine for COVID.
Excellent. Let's talk next about vaccine effectiveness. How well have we seen this vaccine working in COVID?
Yeah, so just kind of as a reminder, 94 and 95% effectiveness against symptomatic COVID, going back to the original emergency use authorizations a year ago, close to 100% effectiveness for severe COVID. So those numbers are very good, for compared to most vaccines, and very good overall. I think better than what most experts had hoped for when we go back a year when we were originally trying to get vaccines approved.
That's excellent. I mean, that kind of efficacy or usefulness is unheard of in most other vaccines. So
yeah.
So you hear a lot of talk these days about additional dosages. Let's start off first and let's talk about the third dose.
Sure. So, when we talk about vaccine effectiveness, we do know that there are certain folks who vaccines don't work very well in, and in particular, immunocompromised persons. So vaccines work by, essentially tricking your immune system into making antibodies against the virus. And but if your immune system is compromised, if it's not operating normally maybe because you're getting chemotherapy or because of a certain disease state that you have, or certain medications or high dose steroids, you're less likely for the vaccine to be effective. And so third doses have been introduced, last summer for folks in those categories. We're talking about 2 or 3% of the population who it may make sense for them to receive a third dose at or a little or more than 28 days after the original 2-dose series. So a little bit different than a booster. This is specifically for immunocompromised folks, just to make sure that the initial series, or to help assure that the initial series will provide adequate antibody levels to prevent especially severe COVID infection.
Okay. Now, you tossed out the word booster, so let's talk about that next.
Sure, absolutely. And so we know with all vaccines, and the same thing if you actually have influenza or you have a cold, you may have antibody levels, and those tend to wane with time. And that's what happens with vaccines. With time, the antibody levels slowly go down. And so with some vaccines, that happens over maybe decades, and with some vaccines, it can happen over years. So we are starting to see antibody levels gradually decline in patients who had been vaccinated, 6 months or more ago. It's important to understand there's other immune components with the vaccine. So we pay attention to antibody levels. Those are the kind of the first line of vaccine defense that act quickly. But there's other components to your immune system that antibodies can create and that are there, and then that can help you prevent you from getting severe disease. But as we see these antibody levels decline, we're also starting to see some breakthrough infections, mostly mild to moderate infections. So folks that had been vaccinated, we are starting to see some more severe COVID breakthrough infections, relatively small numbers. But in particular, folks who are, older in age, maybe have other comorbidities. We're starting to see that occur with folks who had been vaccinated, 6 months or more ago.
Okay. What about the variants? How does that play into, the vaccine, effectiveness?
Yeah, great question, Gabe. So, we're starting to see some breakthrough infections. And so is that due to waning antibody levels, or is it, possibly likely a contributing factor are more contagious variants such as the Delta variant? Another factor to seeing more breakthrough infections could very likely be that we're not, a lot of folks aren't wearing masks and taking precautions like we were early this year and late last year. Just because with time, things have changed, obviously. So those things are probably contributing to the number of breakthrough infections that we do see, as well as potentially, decreasing antibody levels 6 months or more after vaccination.
Okay. So with the booster doses, what's our game plan or our goal in mind, with these booster doses?
Sure. So a booster dose is just essentially a dose that you get, a certain period of time after a primary series. Getting a booster dose should bump those antibody levels back up, somewhere where they close to where they were with the original series. Breakthrough infections, and also most importantly, decrease the incidence or risk of a severe breakthrough infection.
Gotcha. Okay. Probably a big question we get is, do I need a booster dose, or when should I plan on getting a booster dose? What can you tell us about that?
Sure. So what the FDA is, based on what they're seeing and the surveillance that they're doing, they're suggesting if you received a Pfizer or a Moderna series 6 or more months ago, it would be a good time to consider a booster dose. And in certain patient populations, and we can get to that in a second, for Johnson & Johnson, there's been a little bit more breakthrough infections, a little bit lower antibody levels. And so that was just a 1-dose series, as you recall, if you received Johnson & Johnson. So the recommendation is to get a booster dose 2 months after the original J&J dose.
Okay. You talked about kind of determining or describing a little bit more of that. What about the Johnson & Johnson's? What should we do with that in regards to, the boosters, kind of mixing and matching or things like that? But actually, you know what? I think I jumped ahead a little bit in our talk.
No, that's fine. So yeah, anybody who's received a Johnson & Johnson, which is single dose series, they
Mhm.
are eligible, or the recommendation is to consider a booster at or after 2 months.
Okay.
It could be another Johnson & Johnson booster dose, or it could be one of the other vaccines. And yeah, we'll get to that a little bit. For Pfizer and Moderna, the antibody levels have been sustained a little bit better, and so we're looking at somewhere around 6 months or more.
Okay.
And the FDA has kind of specified, the higher risk categories who should get a booster. So persons that are 65 and older, persons living in a long-term care facility, persons who are 50 to 64 but have also other conditions that may put them at risk. So
Okay.
diabetes, heart disease, lung disease, being overweight, those things put you at a higher risk. So those three groups, 65 and older, long-term care facility residents, and folks 50 and older with other conditions should get a booster or should consider getting a booster. And then there's a couple of other categories who may want to get a booster. So those are folks 18 to 50, 18 to 49, who also have those underlying medical conditions, and folks in that same age group who may be at occupational risk. So if you're checking folks out at a grocery store, or you're in a manufacturing facility and a lot of folks inside, maybe you work in a healthcare facility. So all those occupational, all those occupations have some risk because of proximity and so forth to the public.
Definitely. Okay. Now, how can we help patients kind of figure out what boosters should they be getting? You'll hear talked about kind of sometimes in the media, the mix and match. What can you tell us about that, Luke?
Yeah, so the most data we have would be if you got a Pfizer series 6 months ago, and then you would get a Pfizer booster now, or a Moderna series, 6 or 8 months ago, to get a Moderna booster now.
Okay.
But there are some instances where we've seen different boosters given relative to the original series. For instance, there was a lot of folks in the UK who received the AstraZeneca vaccine, which is very similar to J&J vaccine. And because of availability later on, they received the RNA vaccine. I think it was by and large Pfizer. So there is some data out there, and the FDA is basically saying, you can consider getting a different vaccine than the original series, depending on availability. So, I guess if you're 65 plus, or if you're 75 years old and you're at your provider's office and you received Pfizer, 6 or more months ago, but he has Moderna available, it may make sense just to go ahead and get the Moderna and get it done. And just since that's what's available there, or if you want to, you can seek out a Pfizer dose from another location.
Gotcha. So it seems like what you're saying is that just based on availability, if you can get the booster and you want the booster, it doesn't really matter so much which version of the booster you get. Is that correct?
Yeah, that's correct. And we'll learn more as we go forward. But the theory behind it is, Gabe would suggest that any of the vaccines will provide some of the protein, and again, kind of stimulate an immune response and should boost antibody levels. We'll certainly keep learning, about these vaccines and COVID in general as we move forward over the next couple of years.
Okay. What kind of side effects have you been seeing among the patients that have been gotten their booster, I should say?
So mostly, if you receive the 2-dose series, you probably recall you may have had more side effects with the second dose than the first dose. That's kind of typical because your immune system has some antibodies in place, and so that second dose, when you get that, your immune system tends to react more robustly, if you will. And third dose, or the booster, is going to be about like the second dose for the most part. So the incidence and severity of side effects is very similar with the boosters as people experience with the second dose of vaccine in a 2-dose series.
Okay. Yeah, from a personal, experience myself, my third dose, or I should say my booster, I had very similar side effects to my second dose. So.
Yeah, and it's going to vary a little bit from person to person. So it's good you brought that up because you just never know for one individual person. and kind of where your body's at that point in time. But on the average, you can expect
Okay.
side effects similar to second dose.
Okay. Where can patients find their booster shots at?
Yeah, in general, they're not too hard to find. Most of our KSB primary care offices, so to include Town Square Center, Oregon, Amboy clinics, they have Moderna available, and that can be used for original series or booster doses. And also, pretty much all of our local pharmacies have vaccine available. So they may not all have all the vaccines. So just check with your local pharmacy and find out what they have available, or your primary care provider. And you can always check the local health department COVID website for more information as well.
Okay. Last but not least, I just want to kind of touch upon, what are we expecting kind of going into these winter months in regards to COVID? I know that we've had a lot of what I'd call pandemic fatigue, just where it just keeps kind of going, but we've had a nice little kind of lull. Are we expecting that to continue?
Really hard to say. Winter months are always a little bit higher risk for viral infections, and so there's certainly some risk, and we're starting to see some increase in certain pockets in the country. But we have a lot more people with either natural immunity or who are vaccinated. We're also getting closer to having some other therapeutics where we can actually treat somebody who's got a positive COVID test, and hopefully prevent the hospitalization. So we're hoping to have that coming in the next few weeks, but more to tell. I'm kind of fatigued. When you speak of fatigue, I'm fatigued. I'm trying to think I might know what's going to happen in the next month through this last year and a half.
All right. Well, I appreciate being here, and I appreciate you sharing some great information with us. I also want to thank KSB Wellness for this series that they're putting on Facebook each week from the various KSB departments. And we want to thank our providers and our patients. So.
All right, very good. Thanks for working with me on this today, Gabe, and everybody have a good night.
All right, take care.